Hi, everyone. Welcome to the latest Climate Smart Healthcare webinar. Today's webinar is titled Reducing Healthcare's Carbon Footprint, a Roadmap and Tool for Decarbonization. I will first start by introducing our organizations. Healthcare Without Harm is an international NGO with a mission to transform healthcare worldwide so that it reduces its environmental footprint, becomes a community anchor for sustainability, and becomes a leader in environmental health and justice. Healthcare Without Harm has regional offices in Asia, Europe, and the United States, a regional team in Latin America, strategic partners in all of these countries, including India, as well as international partnerships with UNDP, WHO, and other healthcare organizations. And one of the strategic partners in India is Center for Chronic Disease Control. We are a New Delhi-based not-for-profit organization with the primary goal of addressing chronic diseases in developing countries. We have been partnering with Healthcare Without Harm since 2016 in implementing their projects in the country. Now I will hand over to my colleague and team head, Dr. Purnima Prabhakaran. She will walk you through the context of the Climate Smart Healthcare webinar series.
Thank you, Indu. I'm not able to start the video, Mazroor, but that's okay. I'm just going to go ahead in the interest of time. Good evening, good morning, and good afternoon to all the participants who are joining us today for the next edition of our Climate Smart webinar series. As my colleague Indu just shared with you, we have been running this webinar series for a few months now with the sole objective of increasing awareness and sensitizing healthcare professionals in India, representing both the private as well as the public health systems on the concept of climate smart healthcare. And when we are talking about climate smart healthcare, what it really alludes to is two different pillars, and that is adaptation and resilience, which speaks to the preparedness of the health sector in dealing with the increasing disease burden that is likely to come with acute climatic events. And the other pillar is on greening or mitigation, or the concept of reducing the footprint of the health sector, the carbon footprint of the health sector. Now, this webinar today is going to be focusing on the mitigation component. We have been addressing different concepts in the series so far. We've talked about building sustainability. We've talked about water resource efficiency, energy efficiency. And this webinar today is actually getting into the nitty-gritties of what it takes to do on the ground, getting into mitigation in the health sector. And to start that, we actually need to document at the outset a baseline evaluation of where your healthcare facility stands in terms of its carbon footprint. And if you do that, going forwards, once you incorporate sustainability principles in your health services, you can monitor yourself on the path ahead on how you're doing in terms of reducing your carbon footprint. So I do not want to stand between the guest speaker we have today, Ms. Antonella Risso. Indu will be introducing her shortly. But I just wanted to say this is the start to actually getting healthcare facilities on board to start monitoring their climate footprint. And going forwards, there'll be a lot of hand-holding that will be done by the team in moving you ahead on this path. So I'll hand over back to you, Indumati, and just close by saying thank you, Anto, for joining us today as the guest speaker and to conduct this training for our members of GGHH, the Global Green and Healthy Hospitals in India. Indu, back to you.
Thank you for that introduction, Dr. Purnima. I will first start my presentation by, hope all of you can see my screen. Yeah, I'll start my presentation by talking about what the healthcare sector's carbon footprint is. So what exactly is the emissions that are released from the healthcare sector? So this has been studied by Healthcare Without Harm organization. They released a report in September 2019 titled Healthcare's Climate Footprint. And this was the first report ever to estimate healthcare's global carbon footprint. And what this report found was that healthcare sector contributes to 4.4% of global net emissions, and this amounts to about 2 gigatons of carbon dioxide equivalent. And this is equivalent to the emissions from around 514 coal-fired power plants. And that is a lot of emissions that is released by the health sector. And if the health sector was a country, it would be the 5th largest emitter on the planet. This report also studied the emissions of the health sector of various countries and found that the top emitters in terms of countries are the United States, China, and the European Union. Together, they contribute to more than 50% of global healthcare emissions. India is 7th on the list, but it has the lowest per capita emissions out of all the countries that were studied in this report. This report also categorized the sources of emissions in the healthcare sector, and it found that 17% of healthcare's emissions comes directly from the health facilities. So this is termed as scope 1 emissions, and this emissions comes directly from the buildings of the hospitals itself and their operations. 12% of healthcare's emissions comes indirectly from purchased electricity. So when hospital buildings purchase electricity for their use, that causes indirect emissions, and this is 12% of the health sector's emissions. The biggest share of the health sector's emissions is from the healthcare supply chain, and this is termed as scope 3 emissions. And this comes from the production, transport, use, and disposal of products and services by the health sector. This other pie chart here shows us a more detailed classification of healthcare's emissions split up by production sector. So here you can see things like how much emissions comes from healthcare's use of computers, electronic equipment, rubber and plastic products, waste treatment, pharmaceutical and chemical products, transport, agriculture for food provision. So all of these sectors contributes to healthcare's carbon footprint, and this chart shows us how much each sector contributes. And one important thing to note is that fossil fuel combustion is the most dominant source of healthcare emissions, healthcare's climate emissions. And this contributes to 84% of emissions in the health sector. And this is across all of the sectors. So fossil fuel is burnt for the production of computers, for pharmaceuticals in the agricultural sector, for waste treatment, for rubber and plastic products. So the burning of coal, oil, and gas in the supply chain and processing of healthcare is the most dominant source of healthcare emissions. So now I've given you sort of a brief look into what the healthcare sector's climate footprint is. So now let's see where we go from here. What do we do with this information that we have? And one important thing to note is that the health sector has a responsibility to take climate action, because this is because the healthcare sector itself contributes to the problem. As I mentioned, 4.4% of net emissions is from the health sector, and this is going to grow in the coming years. And this is not an insignificant number, and we have to mitigate these emissions from the health sector. Another important reason is that the climate crisis is a health crisis. Climate change is the biggest health threat in this century. Every single effect that climate change will have on the planet is invariably going to affect human health, either physical health or mental health. And it's very, very important that the healthcare sector prepares for it, because all of that is going to increase the burden on the health sector, which is why the healthcare sector should adapt and become resilient to face the increased threats of climate change, which will include things like extreme weather events and increased disease burden. Another important thing to note is that the healthcare sector can be a very important leader and advocate for climate action. And this is because nurses and doctors are among the most trusted voices among professionals. Unfortunately, for a lot of different reasons, public don't trust the voices of scientists and other professionals, but they do trust the voices of nurses and doctors. And therefore, we have a responsibility as healthcare professionals and health sector to advocate for climate change as a public health issue. So now let's move on to how we can decarbonize the health sector. How do we reduce this 4.4% of emissions that the health sector has? So this has been charted out in a report titled The Global Roadmap for Healthcare Decarbonization. This report was released by Healthcare Without Harm in April this year, and it's a very comprehensive report that charts out 3 pathways and 7 high impact actions that the health sector can take to reduce their emissions. It also further provides recommendations that the government, international organizations, private sector, and civil society can take to help with healthcare decarbonization. And this report can be accessed in healthcareclimateaction.org. For all of you to view, it's accessible online. The 3 major pathways to decarbonize the health sector are given here, and these are interrelated, overlapping broad pathways that can help with navigating healthcare decarbonization. The first pathway is to decarbonize healthcare deliveries, facilities, and operations. This comes in the core of the sector's footprint. And if we take action in this section, it can reduce emissions by about 20 gigatons by 2050. Pathway 2 is to decarbonize healthcare supply chain. And as I mentioned before, supply chain causes about 70% of healthcare's emissions. And taking interventions in terms of electricity sourcing, production, packaging, and transport in the health sector can contribute to 11.5 gigatons of emissions reduction. Pathway 3 is to accelerate decarbonization in the wider economy. Societal decarbonization is equally important along with healthcare decarbonization in achieving net zero emissions. And if it happens together, it can contribute to a reduction of about 14 gigatons of CO2 by 2050 in the health sector. The 7 high impact actions shown here have been identified in the report as actions that the health sector can take to create a very big impact in their decarbonization efforts. And these impact actions cut across all of the 3 pathways that I just mentioned. And they include having renewable electricity for healthcare, having zero emission buildings, sustainable transport for healthcare, providing sustainable food and supporting climate resilient agriculture, having low carbon pharmaceuticals in healthcare, having a sustainable waste management practice and circular economy in healthcare, and finally, establishing health system effectiveness and efficiency. I will now go through each of these in a little bit more detail. And there are a lot more points in the report that have been given for each high impact action. And if anybody is interested, you can look at the report in your own time to get more detail. I have selected some of the major points under each high impact action. So for the first one, in powering healthcare with renewable energy, some of the steps include to have on-site production of renewable energy, such as having rooftop solar power or purchasing green energy for on-site operations in hospitals. And it's also important to have microgrid backups for renewable energy in the facilities. In terms of energy efficiency, it's important to educate staff on electricity conservation, to use energy efficient appliances in hospitals, and also to switch over to cold chain technology for vaccine distribution. The second high impact action is to invest in zero emissions buildings and infrastructure. And one of the main steps we can take here is to first even reduce the demand for very big resource and intensive hospital buildings. And this we can do through promoting processes such as telemedicine and teleconsultation, and also preventive medicine in sense of improving public health so that they don't need to access a lot of high energy and resource intensive buildings. Other steps include to have effective building usage, designing buildings according to green building accreditation, and while refurbishing or renovating hospitals or building even new hospital buildings, to reuse and repurpose building materials so that we don't use a lot of virgin materials. Another step is to have a lot of blue-green infrastructure in hospital premises, which is to say a lot of plants and water fixtures, which will increase cooling in the premises and also provide space for things like rainwater harvesting. The third high impact action is to have sustainable transport in hospitals for hospital functions. And some steps include to incentivize the staff to use public and active transportation. And this includes making sure that hospital staff come to and from hospitals using public or active transportation such as walking or bicycles. and where possible to encourage active transport even for patients, and also have healthcare facilities close to public transportation. This is very important to make sure that healthcare is accessible, and also to reduce the use of private vehicles. And in terms of business travel for healthcare professionals, just to reduce business travel by encouraging virtual meetings and also disincentivizing the use of high carbon travel such as air travel. And in terms of vehicle fleets in hospitals like ambulances and other vehicles, making sure that the use of vehicles is zero or low emissions in hospital fleet, and also making sure that vehicles are maintained regularly to increase their longevity. And also in terms of the supply chain of hospitals, to optimize the supply chains and ensure bulk ordering so that there is not more frequent use of vehicles than needed. The fourth high impact action is to provide healthy, sustainable food in hospitals. And this can be done by promoting and procuring local and seasonal menus, by reducing food waste that is generated in the hospital, and that the food waste that is generated is treated through composting, preferably near the hospital premises. And if available, hospitals can utilize their hospital grounds to grow food for their patients and staff, and also to ensure that food that's procured for the hospital is coming in reduced or sustainable packaging. And another important thing is to use energy and water efficient technology for cooking and washing. So basically in kitchen functions, to use energy and water efficient technology. The fifth high impact action is to incentivize low carbon pharmaceutical use. So one way to do is to establish prescribing only when necessary. So to ensure that pharmaceuticals and medicines are not prescribed when not necessary, also to encourage early patient diagnosis, to switch to low emissions inhalers and low emissions anesthesia, and also to procure pharmaceuticals in efficient and sustainable packaging. The sixth high impact action is for proper waste management in the health sector. And this can be done by firstly just reducing the waste that's generated from the hospitals, and also ensuring that the waste that is generated is segregated based on local guidelines, and that they are disposed according to local guidelines in safe ways. And it's also important to phase out incineration as a process for medical waste disposal where feasible. So in places where it's feasible to autoclave instead of incinerate, we need to ensure that that is followed. And it's also important to establish dialogues with manufacturers to prevent the generation of waste itself. And in similar lines, introduce extended producer responsibility for the supply chain and factories so that they take responsibility for the waste that they will generate. The final high impact action is to establish greater health system effectiveness. And this can be done by eliminating unnecessary procedures and practices. So a lot of operations and procedures are very, very high intensive in terms of energy and resource use. So just ensuring that they are done only when necessary contributes to more health system effectiveness. And reducing inefficiencies in the health sector, combating over-treatment and over-prescribing of medicines, and also aligning health financing with broader goals of universal healthcare, decarbonization, and resilience. So this is sort of the 7 high-impact actions of the health sector that they can take to decarbonize. And this graph here shows us how, if we take all these steps, how the health sector's carbon footprint will reduce. So I'll just go through this graph really quickly. So in 2014, from the first report, we knew that 2 gigatons was the emissions of the health sector in 2014. And this graph does a projection of how healthcare footprint will increase up to 2050. And the first scenario that they've done is the business as usual scenario. So in this scenario, it considers that nothing changes in our operations, everything stays the same, and healthcare functions as it does in this moment. So in this situation, healthcare's carbon footprint would increase up to 6 gigatons in 2050. And this graph shows that if we take climate action, how much can the footprint reduce? So this wedge here represents how much the footprint would reduce if countries follow through with their Paris Agreement commitments. So for those of you who don't know, Paris Agreement is an international agreement that a lot of countries signed up for, and they committed to reducing their carbon footprints by a certain level by taking a lot of different actions in different sectors. So if all of the countries follow through with their Paris Agreement commitments, healthcare's footprint would increase only up to 3 gigatons in 2050. Beyond that, if the healthcare sector takes action in all of these 7 high impact actions that I just mentioned, healthcare's footprint can reduce well below and go up to just 1 gigaton in 2050. So this graph shows us the potential for decarbonization in the health sector based on government's action as well as healthcare's action. And there's also scope for more decarbonization as shown in this dotted line. So this is uncharted territory for a lot of places where we don't have enough data and evidence yet. We don't have enough research to engage in more decarbonization actions. So once we get more data, once we know more about how to decarbonize in certain areas, there is more scope for decarbonizing in the health sector. So this brings me to the end of the technical and research aspect of healthcare's carbon footprint and the decarbonization. Now let's move on to the practical realities of how the healthcare sector is taking climate action. One of the biggest ways that the health sector is taking climate action at the moment is through the Race to Zero campaign. This is a campaign started by the UNFCCC, the United Nations Framework Convention for Climate Change, and it's a global campaign for a healthy, resilient, and net zero carbon emissions by 2050. So as of now, over 45 healthcare institutions representing over 3,200 hospitals in 18 countries have signed up for Race to Zero. And 4 hospitals from India have signed up to this campaign. And what hospitals who sign up have to do is to first measure their current emissions to use as a baseline. So if a hospital is starting out with Race to Zero in this year or next year, they would measure their emissions and say in 2021, we had this much emissions, and that is their baseline reading. And from there, they will set emissions targets. And the common target for all Race to Zero participants is to achieve net zero emissions by 2050. And Race to Zero participants can also set interim targets, which, for example, could be achieving 50% reduction by 2030 or whatever is feasible based on their hospital. And after setting their targets, hospitals take action based on their targets and their plans. So like I mentioned, 4 hospitals from India have already signed up for Race to Zero. And if anybody else is interested in joining Race to Zero from India, please email us at help.ceh@phfi.org, and we can help you with starting your decarbonization journey in the hospital sector. So now I will hand over to my colleague Antonella, and she will be talking to you about how exactly hospitals can measure their carbon footprint. So my colleague Antonella Risso, she is the International Climate Technical and Research Manager in Healthcare Without Harm. She has been doing a lot of work in the sector, primarily on helping hospitals to measure and reduce their carbon footprint. She has also been working on creating a global network of hospitals around the world who are working on healthcare decarbonization. And the latest project of hers and her team is to create a carbon footprinting tool that hospitals can use to measure their carbon footprints and engage in decarbonization activities. So without further ado, I would like to welcome my colleague Antonella Risso. She will be giving you an introduction to the carbon footprinting tool that they have developed. And just as a note, we will be having another webinar in a few weeks where she will give a more detailed session on how to use the tool itself. But for now, she will be giving you an introduction on what the tool is. So over to you, Anto.
Hello, Indo. Hello, everyone. Can you hear me?
Yes, Anto.
Okay. Yeah, I'm trying to share my screen now because my internet is not working at home, so I'm using, no, I want to continue. Let me find my slides. Can you see my slides now?
Indu, do you have to give the share option to Anto? I mean, we can still see your slide on how can hospitals measure their carbon footprint at this point.
Maybe we need to change who's presenting.
Yes.
Or maybe Indo, because I'm with the phone, so this is not that easy. Okay.
No. We can see your screen, but not sure.
Yeah.
Indu, can you share the slides instead?
Sorry. My internet is not working this morning, so I'm with the phone.
Yeah, we can see it now, Anto.
You can? Yeah, the thing
Yes.
is that I cannot go on on present mode. Like,
Okay, Indu, do you have Anto's slides and can you share them instead?
but can you see now? Like, can you see this?
Yes, we can see your slides.
Okay, so let's try like this in the meantime. Okay, so thanks for inviting me. I'm sorry that we are having technical issues today. As Indu was saying, and for Nima were saying before, we have offices around the world. I come from Latin America. I live in Argentina. So I'm participating from there today, and I'm part of the global team, as Indo was saying before. And what I'm here to present you today, Checkup, that it's our carbon footprint calculation tool, that it's not a checklist, as Dr. Shalini was asking a few minutes ago, but it's part of our climate mitigation strategy. What you can see here is part of what we're working on is like below in blue, you can see the facilities tool. We are working on trainings, integrating these two other initiatives like the Healthcare Climate Challenge and Race to Zero. And we're going up from there, and up in the orange part on the left corner, you can see the roadmap, what Indo was presenting right now. We are working on different tools, initiatives, and methodologies to help the healthcare sector and healthcare facilities to track their emissions, to build their plans. And we can do that with really different methodologies. But the most efficient one is to calculate your own footprint. And roadmap give us national information that we cannot have like by detail, but we can build these global scenarios for many countries with the roadmap. And with the facilities tool that I'm going to present right now, you can monitor your own facilities footprint. So how did we develop this tool? As Indo was saying, we have been working on this for a few years. The development of this tool started 5 years ago in Latin America. It was an Excel tool by then, and it was used by some countries in Latin America, and we learned a lot from that experience. In 2019, we started organizing some events that we called Huellatones. That it's an event like you can see there. That was the last actual in-person workshop that we organized. There, I like this picture because it shows the diversity of our own network, because in that picture, you have doctors, you have maintenance people, you have nurses, you have quality assurance people. That diversity, it's in our network, it's in our leaders. So we wanted to create a tool that was useful and really easy to use for any healthcare professional or worker that wants to start tracking emissions. And so we started organizing those events. And in 2020, we started a global process to take this tool to the global level, to update it, to upgrade it. We compared 4 tools that were available in the world. We implemented a global consultation process with experts and some GGHH members, and we coded it. So this tool today It's not only an Excel sheet, but it's also online. I'm going to show you what is good of that. And in 2021, we launched the guidelines, the tool. We have some benchmarking available, and we are working on future phases as integrating a hotspots tool to identify hotspots actually in the supply chain. That, as Indu was saying a few minutes ago, is the largest piece of the footprint, but it's not that easy to track in a global tool for any country. So we're working on that. So if this is the first time you see about footprints, footprints are usually organized like this. By scopes, we talk about scopes when we talk about carbon footprints usually. So scope 1 are direct emissions, fuel combustion, company-owned vehicles, and here in scope 1, we also have anesthetic gases, and we have cooling-related gases too. In scope 2, that's the easiest one in most of the countries. It's just the electricity you buy from the grid, of course, if you're connected to the grid. And scope 3, it's the biggest piece because that's indirect, and it includes your whole supply chain, but it also includes your waste treatment. If it is off-site, waste treatment if it is on-site, that's scope 1. So that's direct and indirect. So, and as India was saying, in a few weeks, we can go deeper with this, with the ones that want to go deeper. So that's scope 1, 2, and 3, and that comes, as it says there, from the GHG protocol. That's a really renowned protocol to work on emissions. What the tool includes today on scope 1 is your stationary combustion. So you can track emissions from stationary combustion. For example, if you have diesel generators for backup generator, or if you're producing your own electricity, or if you have boilers and you're producing steam, or, well, that's stationary combustion. So we track those. We track mobile combustion, that's your own fleet, your ambulances and cars that the facility may own. And fugitive emissions are called the cooling and medicinal and anesthetic gases, and waste on-site treatment. For example, if you're composting on-site, compost is a very good activity and we want to keep doing it, but it has some emissions related, so it is there. Scope 2, as I told you before, the purchased electricity. And scope 3, we have business travel there, electricity transmission and distribution losses. This is automated, you don't have to do anything here, but that's calculated and comes from the scope 3, 2, from the electricity. Inhalers, that's the only drug that we can track today globally. That's it, and it's a very good thing because it is relevant. And the waste of site treatment, I have a team is in there. Oh, it's there in scope 3. So that's where your common waste go. If you are incinerating off-site or autoclaving, whatever treatment that you do off-site, scope 3. Employee commuting. And this is good to track one of the things that Indu was showing, like the pathways to go to zero emissions. So employee commuting and patient commuting that we have below are related to activities that you can actually do that are not easy to do, but that you can do to reduce your emissions. And the patient commuting is one of the things that I really like, because we are tracking there not only how we recommend just to do this like once a year, a survey that you do to patients. So you ask them how they got to the hospital and why. So if we can identify that is a visit that could be replaced by telehealth or not. Sometimes I'm pretty sure it happens to you, but it happens to me here where I live in Argentina, that I just go to the clinic or to the hospital to pick up some lab results that could be shared with me by other way. I don't need to go and pick the piece of paper, for example. Or sometimes you go just to talk with your doctor, and that could be replaced by an online meeting sometimes, and sometimes it couldn't. So that's why we're tracking patient commuting, so to see the reasons and a few more things. The next phases, as I was telling before, are the supply chain hotspots. We are working hard to have a tool that is valid for many countries, that is going to be integrated with this tool. And that should be ready by the end of this year. And we're about to implement a pilot to test that, so we have it ready by the end of this year. We are working to make the reporting easier, so we are working all the time on that. We are working in development of an online course that is going to be ready in a year from now. We are starting on that. And we're working on more in the development of more case studies. And one very important thing is that your feedback, members' feedback, and it's very, very important for us to learn and to identify what we can do to make it easier for you to report and to make this tool more useful. So your feedback is going to be greatly appreciated. We have a few years already of experience with using this tool, but we learn really every month new things to make this better. So let us know if you have comments. So how do you access to this tool? If you are a GJH member, you just have access. You just need to go to connect.org and log in. If you don't know how to log in, into and others can help you here with that. And once you are in, you need to go to Hippocrates. That is there highlighted in green. And that is our reporting platform. That's Hippocrates, and that's where we report. And if you're not a member, we are working with WHO, so we can implement some pilots with countries. So through that pilot, it doesn't matter if you're a member or not, but it is only through WHO today. So for the rest, you need to be a GJH member, that, as you know, it is for free. So in the online version here, I have some screenshots here that we're going to, as Indu said, we're going to go deeper in a few weeks, but we wanted to share this with you today. So first, you go in Hippocrates to a new form. There's a place where you have data forms. So you go there and you go to Checkup, the climate impact checkup tool. That is the tool. And you can see that it's organized like intro, scope 1, 2, 3, waste. That, as I told you before, could be scope 1 or scope 3. And comments. You have a place there to add some comments. So I don't know if you're seeing this big enough. I'm trying, and zoom in there. But I have just an example there. And if you go to scope 2, you can see their purchase of electricity, and you are going to say there for everything you're going to see in this tool that it says indicate what will be the treatment of this search category. And you have their estimated or not estimated because the data is not available, not estimated because it is too complex, and not occurring. And why is this? Because we want you to start using the tool with whatever data you have. So if you don't have all the data, if you don't have the data from inhalers, or if you don't have the data from cooling or anesthesia, that shouldn't stop you just to start and put the data that you have for year 1, and next year you can add more sources. And I also have an example there of cooling and fire suppression, because yeah, extinguishers also have the gases that produce emissions. Of course, they're not the biggest source, but if you can track them, well, it helps. So in cooling, you also indicate what you are going to do with the sources, but you have there a bigger table that the first thing that you do is to select the type of equipment. Let's say freezers that are for vaccines or just a freezer. And you said that you have a long list of gases there, and you put the quantity there, add the unit. Like always, I would say before putting the quantity, you need to check the unit. And you have a list of units almost for every source. And the yellow part, you do nothing because that's the automated like emissions calculation. So you just, so that's how the tool is organized. So it should be easy to use. If you ever saw spreadsheets related to emissions, they're usually quite complex. So this is the easiest way we found. So, but let us know how you think, what you think about it. And when you finish, you have some graphics and reports. You have a copy of your submission, like a table, and you also have some graphics and reports. So I just wanted to show you a few things here. That, for example, once this is just some fake data, so don't pay attention to that, but it's Once you have submitted reports for several years, you can see your total emissions and the sources, how if you're going up or not. So that graphic, it's automatically created, so you can see it. And you have other graphics, you have more, but I'm just showing a few here. You can see also the total emissions per scope. You're going to see we're always using the same colors to show the scopes that are the same colors from the roadmap. So scope 3 is green, scope 1 is blue, and scope 2 is orange, always in this tool or in the roadmap. So you can see here with this fake data, like I had a lot of inhalers, but that's not real. It's going to be less for you. But that I just wanted to show you how the graphic is created. And you have a few metrics. You have your CO2 emissions per employee, per patient, and per occupied bed. And this is created with data that you have in your profile that you need to update for every year that you're going to calculate emissions. Because you need to have, if you're going to calculate 2019, you need to add in the profile your 2019 data of employees, patients, and occupied beds, like the average annual occupied beds. And you also have a treatment summary. That's one of the things, as you're going to say, if you're estimating or not. We created this table for you to know on year 1, if you estimated 5 sources, but you didn't estimate, like here it will be 7, you can just put that in your plan for next year. So you can reduce one of these and say, well, if data wasn't available for 2 sources, like mobile combustion, let's try to have it next year. So, and you have more, but you can check that online. And just wanted to tell you that as you are probably, some of you are going to start working on this, we just wanted to tell you about one system in Valdivia. This is the south of Chile, it's there in the map. It's close to where I live. And that's a meeting that we had 2 years ago with the public system. These are 9 hospitals in the south of Chile that started developing their baseline 2 years ago. And now they are part of Race to Zero, and they have made many changes and are being an example for the rest of the country. So we have a case study now online about this. And just for you also to know that when we were developing this tool, we implemented a pilot with institutions from different countries like Argentina, Australia, Spain, Greece, and we had a few more like Singapore, and we are working now that the tool is launched. There are hospitals in South Africa to using it, and Indonesia and other countries are already using it. And one more thing, very important one, is that we have developed guidelines. So now divided in 3 pieces, there's a 4th coming in the following weeks. Part 1 of these guidelines is how to use the tool. That is online, and you can see it in the intro. When you go to High Properties and you go to this tool, in the intro page, you have a link to the guidelines and a link to the Excel sheet too. So if you want to use it as an Excel sheet because it's easier for you because of internet access, or so you can use it in an Excel, and just when you want to report and when you want to share the data with us and create all the graphics and you're going to see more than a year, you just go online and put the data there. And the part 2 is how to create an action plan. There's a very basic action plan and how to set goals and how to work on that. That's part 2 of the guidelines. And part 3 should be online really soon. That is about how the tool was developed. It just tells the story of how this tool was developed. And just wanted to show you an example that one thing that you can see this is just how it is structured, the part 1, with the example of scope 2 electricity, that is the easiest one. But the guideline tells you the type of emissions that we are tracking there, the data that you need, and where you can find that data. In this case, it's easy. You need the bills or meters data, but that is how the guidelines are organized. So we hope they are useful for you. If you are new to this, the guidelines should help you to go step by step and use the tool. And coming next, as told you before, we are starting to develop the online course. Feedback is really important, so I'm telling you that again. And it would be good to know what type of training you think you need. And global data, that's coming next. I think we have a great opportunity here to learn more about carbon footprints in facilities and systems around the world, that there's not a lot of data around the world about this. We have some, like the roadmap nationally, and there are other research like the roadmap going like with national data. But at facility level, there isn't much really. So, and below you have a screenshot from a few days ago with every blue dot there, it's a carbon footprint already calculated with the tool. We had, I checked today, we had 170 today since July when we launched. So we hope we can have some dots in India in a few months. So we invite you to add your reports there. This is completely confidential. So the only information that the map shows is that there is a report there. And it only goes the map if you zoom in until the state. So you cannot even tell what that hospital is. But you can see that from that country and that state, there's a report shared. And we like it because it helps really showing momentum. So thank you. Gracias, it's thank you in Spanish. So I wanted to share that with you. Do you have any questions? Hello, can you hear me?
Yeah, thank you, Anto, so much for the presentation and introducing the tool for all of us here in India. Now we'll open up the webinar for questions. You can ask questions regarding the roadmap or the tool itself.
I request participants, if you are not able to type your query in the Q&A box, you can raise your hand and I'll give you the speaking rights.
So Dr. Shalini has asked, will the tool be shared with participants? So if you're asking if the tool will be shared with participants of the webinar, it is not currently accessible to everybody here. It is accessible to hospitals who sign up to the GGHS network or who sign up to the Race to Zero challenge. It is not available for individuals at the moment. And also, if another question she asked was if it's done in their hospital, who will certify? What do you mean by?
Yeah.
Sorry, Anto, okay. You can go ahead. Yeah.
Yeah, there's no certification, Shalini. You should do that with a certification company if you want to. So this is a tool that is developed using the GHG protocol that has many years of use. And what you have in the tool, when you download the Excel sheet, and if you go to intro, want to download information, you can download their references. There's a references page that explains like all the data behind it. And you have the guidelines and you have there all the references really to know how the tool was built. So if you're working with consultants, they can just really easily track how the tool was built. Or if you want to participate in a national program and you need to certificate it. But we at Healthcare Without Harm, we are not a certification company. So we don't do that. And what we're trying to do is to have the GHG protocol mark in the tool. So that is going to make it a lot easier when it's certificated by them, but they don't have the capacity really right now. They just stopped like 1 year ago receiving more applications. So, but we're trying to do that. So, and as Indu says, to be a member of GGHS, it's for free. And that's how you get access to the tool, really. So you need to be members. And that's it. You need to send a letter and become a member.
Jillian has asked a question on what information can we show hospital staff to bring them on board to sign up and try the tool in their hospital. So do you want to answer that question, Antu, based on your experience in Latin American countries?
Yeah, I think one good way would show the information that we have in the new website. Maybe you can share the new website where we have information about the roadmap, Race to Zero, the challenge, and Checkup as a tool. Checkup as a tool, what it helps you is to identify your priorities, so then you can work in your own action plan. Let's say you're working on sustainable procurement, that you want to reduce the emissions from waste treatment, or that you want to reduce emissions from transport, or you just want to know how it is. You want to do something on climate change and you don't know what to do, what you could do. And probably this is a good way of just putting some action there, because sometimes we don't know what we could do. Well, tracking your emissions from your own facility is one way of doing it. And you can easily integrate that, the information that this tool provides you, to your waste work, to your sustainable procurement work. And so I think, yeah, you can show the information that we have on the website. And yeah, I'm sure Indu Masrur can share that with you. Yeah, that's the new website, Healthcare Climate Action. I think we have enough information there. And you have some of the case studies there. You have information about Valdivia, that case that I showed you before. And you have also some information about the state of Mexico that it's also used in the tool. And they have also joined Race to Zero. And both are public systems, really, and from the South. So I think those are good cases, because this tool is being really widely used in Latin America because it's the first place where we developed it, but now more countries are starting to use it. So hope it's useful for you.
Jillian has also asked a question on, can individual members join the GGHS network or only hospitals? So the GGHS network is open only to hospitals and healthcare institutions, not for individual members.
Yeah, if you are, I don't know who made the question, but if you are part of a university, you could join, you could, yeah, convince institutions. Yeah, the network is a network of institutions. But we're working with others that could have interest, like through WHO, some countries, or like medical students associations. And if you're part of some association related to the health sector, you could join. So check that.
Are there any other questions right now? A question on, can public health NGOs join then as well?
Yeah, you can.
Yes. Yeah.
Yes, you can. Public Health Association can join. And you can join if you are the head of a seminar that works on environmental health, like in a university, you can join. There are many ways really of joining, but it is a network of institutions. That's the only thing. It's not about individuals.
Yeah, please go ahead, Abhijit.
Yeah, my question was that in the projection scenario, you have shown that the business as usual, of course, kind of produces large amount of emission in the future. But for the countries and for the countries who are participating and associating with the Paris Agreement, actually, then the emission is not that high. It's starkly low than the business as usual scenario. So my question was that how can you convince the governments actually of different countries just to about by the Paris Agreement, or some additional action is also needed pressingly? So yeah, that's my first question. The second question is that India currently contributes around only 2% of the global health emission actually. So it's not very much, and but it is also not well constrained actually. So how can India can show that, okay, the health emission is also an important greenhouse gas emission from the health sectors, and it can work towards sustainable action and towards some good result in mitigating the health emissions. Yeah, thank you.
Thanks, Abhijit.
Thank you.
Yeah, I think there are probably different ways of doing this. One way is that to be able to adapt to climate change and to build resilient healthcare systems, we have no other way of doing that than reducing emissions too. To build a resilient healthcare system, you need to work on mitigation, to work really to have safe air to breathe. You work on climate mitigation. And it's safer, it's cheaper many times. It depends on what you're trying to see. And India is 2% of the emissions, but the thing is that the healthcare sector in India and in my country and in all Latin America, for example, needs to grow. So how that system grows, it is important. When you build a new hospital today, that building is going to be there for 50 years or more, a lot more usually. So we're in 2020 right now, 2021, in 50 years, that's 2070. That's a lot in climate change time. So I think it is important to know how we really think how the future needs to be. So and if we're going to solve the climate crisis, and if we're going to solve the sustainability crisis in general, that there are many things to do for us here, and every country has a role to play that they don't have to. Not all countries need to do the same, but I think it is important when the healthcare system grows, and in the goal of achieving that universal health coverage and that coverage of beyond equality, that's going to be greening away. It needs to be. There's no other way, I think.
Right. Thank you very much.
Thanks.
We have one more question by Purvi. They're asking if 6 monthly assessments is supported by unrecommended in the tool, if we can do assessments in 6-month basis.
No, this is an annual tool. What you have in Hippocrates is that you can do monthly for energy only. There's a tool for energy, so you can work on energy monthly. But yeah, you don't have it by month. Yeah, that was asked before, so we can see if we can do it. But that's one thing that we could see in the future, if we could add a monthly possibility. But today, this is only for annual data. So it's for the year before the one that you are in.
Are there any more questions? And also, if people want to email us and get in touch with us, I've dropped the email address in the chat box. You can email us for more questions on joining the network or even the tool or anything. We can also get you in touch with Antonella if required. We are a little bit over time at the moment, so I'll just say thank you so much, everyone, for joining the webinar today. It was a very insightful session on the roadmap and also the Checkup tool that Antonella presented on. And just a reminder that in a few weeks, we will have a more detailed session where Anto will take us through how to use the tool itself. She will take us through how to use it on the online portal and also maybe the Excel sheet. And people who can sign up there are Race to Zero members, but also hospitals who are interested in taking this up are also welcome to join, and we will get in touch with you regarding that. And once again, thank you so much, Anto, for joining us in the webinar today and for taking time to explain the tool to us. If there are no more questions, we will end the webinar here.
Thank you very much for everyone that assisted. And yeah, we're here as Indu says for any question, and hope to see you again in a few weeks.
Yeah. Thank you so much, everyone. Have a good day.
Yeah.
Thank
Have a
you
good
so
day.
much.
Bye.